Investigation of the effect of different treatment methods on the growth of bacteria in eggs. Eggs are consumed widely all over the world, daily, as an important food resource. Hence, it is very important to maintain a good sanitary level in our food resources. If we eat unclean or contaminated food, foodborne diseases or illnesses can spread, endangering the consumer's health. Some of these illnesses can also be contagious, which can also endanger the health of people who come in contact with the consumer. Egg producers should also consider the risk of each egg treatment method before implementing it. This is to ensure the safety and physical well-being of the consumers. For the benefit of both egg producers and consumers, we have conducted this experiment to identify the best and worst methods of waxing and preserving eggs. Our research question: which type of treatment method can reduce the most bacteria count in eggs? Our research hypothesis: the best method of treating eggs is washing and waxing, while the worst method is washing the egg. Before the experiment, remember to disinfect all the equipment and wear a clean pair of disposable gloves. These are the equipment that we will need for our experiment: 12 raw supermarket eggs, 2 dry sandpaper, 2 metal bowl, a fridge, beeswax and paraffin wax of 100 gram each, 12 petri dishes, 12 bacteria swabs, bacteria incubator and germicidal lamp. Now, we'll be showing the experimental procedures. Before handling the eggs, we first melt the beeswax and the paraffin wax. For egg waxing, take one egg, rub it in a metal bowl of water, then shine it for germicidal light for 2 minutes. Afterwards, dip it in the wax for 20 seconds. Now, repeat this 2 times for both paraffin wax and beeswax. There will be a total of 4 wax eggs. For the remaining 10 eggs, wash 2 eggs for 5 minutes in the metal bowl. Wash 2 eggs for 30 minutes in the metal bowl. Dry sandpaper 2 eggs and leave the remaining 2 eggs without doing anything to them. Then, we left all the eggs in the fridge for 7 days. After 7 days of being in the fridge, the eggs are finally ready to be tested for bacteria. To get the bacteria, crack the egg, pour out the contents of the egg and swab the inside of the shell. Then, swab it onto a petri dish with agar. Afterwards, label all of the petri dishes with tape and markers. After which, put all the 12 petri dishes into the incubator at 37 degrees Celsius for 3 days. After 3 days of being in the bacteria incubator, observe the bacteria growth in the petri dish. Record the number of bacteria colonies on the petri dish. Take pictures of all the petri dishes after removing the cover, and then put the picture into ImageJ and analyze the data. Here's our results. Based on our experimental results, the hypothesis: the best method for treating eggs is washing and waxing, while the worst method is washing the eggs without waxing, was not verified. Our results histogram shows that nothing done to the egg has the most bacteria count, while washing the eggs for 30 minutes, waxing it with beeswax, and waxing it with paraffin wax have no bacteria at all. Our results may have been affected by many factors, such as the environment in the fridge or our methods of carrying out the egg treatments. Nonetheless, we still came to the conclusion that the safest option is to consume the eggs as soon as possible after purchasing them.